Welcome to The Explainer. Today, we're diving into something truly fascinating and, quite frankly, widely misunderstood: the complex intersection of giftedness and autism. If you've ever looked at a child's learning profile and felt like the puzzle pieces just weren't fitting together, well, you're in the right place. We're going to untangle the science, the labels, and the real-world behaviors that make these learners so incredibly unique.
Okay, let's dive into this by borrowing a brilliant tactic from the popular young adult novel character, Penelope Bunce. When Penelope faces a tough problem, she pulls out a chalkboard and makes two columns: what we know and what we don't know. When we look at the research from the Davidson Institute about the connection between giftedness and autism spectrum disorder, or ASD, the what we don't know column is actually a lot longer. Diagnoses shift, definitions vary, and neuroscience is still evolving. But today, we're going to focus our chalkboard entirely on what we do know, how these traits overlap, and most importantly, how we can help these students absolutely thrive. To ground our investigation, I want you to picture a very specific yet incredibly common scenario. Think of a 10-year-old kid in a local public school. This child is an absolute whiz at computer programming. They have an intense, keen interest in learning advanced coding languages like Python, which is way beyond their grade level. But when the bell rings for recess, they don't socialize. When forced to do group work, they seemingly withdraw and really struggle to communicate. It's this stark contrast that leaves the adults in their life completely puzzled. So we have to ask the big question here. Is this child gifted, autistic, or both? Think about how different adults might view this exact same behavior completely differently. A teacher might see a highly gifted kid who's just frustrated by waiting for their peers to catch up. A clinician might see an autistic child struggling with social reciprocity. And a parent? Well, they might be caught right in the middle of all this label confusion, just desperately trying to get their child the right support. Here's our roadmap for how we're going to untangle this together today. 1. The label confusion. 2. Defining giftedness and autism. 3. Where the traits overlap. 4. Looking beneath the surface. And 5. Supporting twice-exceptional students. Let's start right in with Section 1, the label confusion. It is entirely understandable that parents and educators have strong reactions to these labels, right? There's a ton of history and stigma attached to both communities. Often, a child who exhibits both advanced abilities and developmental challenges is referred to as twice exceptional, or 2E for short. This is a crucial vocabulary word for us today. You see, a 2E child has an asynchronous profile. This means they can wildly succeed in some tasks, like our 10-year-old coding in Python, while being deeply challenged by others, like the overwhelming sensory input of a crowded playground. The real tragedy of the 2E label is that parents often feel they can't get the benefits of either world. They might be denied advanced learning opportunities because of their deficits, or denied support scaffolding because of their high academic achievements. Understanding this term is absolutely step 1 in advocating for them. Moving on to Section 2, defining giftedness and autism. To truly understand the 2E profile, we need to establish some clear baseline definitions on our chalkboard. First up, autism spectrum disorder. According to the source material, ASD is a developmental condition resulting from a brain-based difference. Now, while it's broadly defined, it primarily centers around differences in social and communication skills, as well as observable restricted and repetitive behaviors like rocking. Professionals use the DSM-5 diagnostic criteria, which includes specific behavioral checklists and severity levels, to help identify it. All right, now let's look at giftedness. Interestingly enough, this is also considered a broadly defined brain-based difference. It's commonly characterized by high intelligence, creativity, or achievement, but here is the critical part that frequently gets missed. Highly gifted children are not always perfectly adjusted high achievers. In fact, they are often described as intense or overexcitable. They can present with executive functioning issues and profound sensory sensitivities, which sounds an awful lot like students identified with ASD, right? Recognizing this intensity is vital to understanding the whole child. Which brings us to Section 3, where the traits overlap. Now, what's really interesting about this overlap is how these two distinct profiles can look practically identical on paper. If a child has an intense focus on a specific topic, the gifted checklist calls it being enthusiastic about unique interests, while the autism checklist calls it having obsessive interests. Both groups show immense difficulty connecting with same-age peers. Both groups can exhibit rigid rule following or lack of pretend play. If you're an educator or a parent just looking at a checklist, it is incredibly difficult to disentangle the two. Let's dig deeper in Section 4, looking beneath the surface.
Because the surface-level behaviors look so similar, trained professionals really have to examine the context and the motivations driving the behavior. But before we even look at motivation, we have to acknowledge the language itself. Notice this comparison: enthusiastic versus obsessive. Deficit-based language often stems from educational frameworks that use performance levels to determine funding or in-class aid. But it is so important to recognize that many in the ASD community find this kind of language ableist and stigmatizing. The words we use to describe the exact same trait often depend entirely on which lens we happen to be looking through.
And this brilliantly illustrates why professionals must look at the why behind a behavior. Take socialization, for example. Both a gifted student and an autistic student might struggle to relate to age peers. But a gifted student might struggle because they have sky-high expectations, they want to dive much deeper into niche topics, and they desire a more mature form of friendship. An autistic student, on the other hand, often deeply desires social connection too, but they might struggle with interpreting facial expressions, expressing their emotions, or the natural back-and-forth reciprocity of a conversation. The outward behavior is the same, but the internal motivation is vastly different. So the crucial point is how we differentiate between the intensity of giftedness and the severity of ASD. Professionals look at the impact on daily life. As Dr. Melanie Crawford points out, when symptoms create prolonged emotional distress and actively prevent a student from engaging in the regular tasks of daily life, well, it can't always be explained away by giftedness alone. That severity is a key indicator that it might be time to evaluate for an autism diagnosis to get the child proper support. It's not about slapping a label on a child for the sake of it. It's about recognizing when they are genuinely suffering and need a lifeline. Finally, let's turn to Section 5, supporting twice-exceptional students. Let's move to and see how this builds into highly practical steps to help these kids. The Davidson Institute outlines a fantastic 3-step framework for success. Step 1, if your 2E child is facing significant challenges, seek a formal assessment from a professional experienced with both gifted and ASD profiles to truly understand the whole child. Step 2, utilize a 504 plan or IEP to its absolute fullest extent. And step 3, enroll them in non-competitive clubs like coding, history, or math, where they can connect with like-minded peers through their specific interests, totally removing the pressure of typical social situations. I want to pause on step 2 for just a moment because it's vital. We so often think of IEPs and 504 plans as just academic tools, getting extra time on a test or help with written language. But for a 2E student, these plans can be used to aid with classroom transitions, which can be highly dysregulating. They can mandate the development of social skills and actively incorporate emotional regulation strategies right into the school day. It is really about building a comprehensive environment where the student feels entirely secure. Ultimately, it comes down to this powerful quote from Dr. Ed Amend. The needs of a child, not the specific diagnosis or identification category, are supposed to drive the interventions. A 2E label or an ASD diagnosis should never be viewed as a declaration of deficiency. It is simply a tool, a key that unlocks access to resources, a community of like-minded peers, and an educational environment tailored to let that student safely explore their brilliance. As we wrap up our chalkboard session today, I want to leave you with this thought. We live in a neurodiverse world filled with wildly successful people who fit the 2E profile perfectly. So how can we, as a society, shift our frameworks to view neurodiversity as an asset rather than a deficit? How do we build environments where our 10-year-old Python coder doesn't just survive recess, but truly thrives? Thank you so much for exploring this with me today. Keep asking great questions, keep looking beneath the surface, and I'll catch you next time.